what is the next big area of your incurables?
The next big area is what I call circulation or movement or exercise. One thing that I briefed on before is it's so important. You can drink all the best fresh organic juices that you can get. You can take the best herbs and you'll get the chemistry of those plants and the nutrients from that juice into your blood. But if you can't get that blood to where the disease or the tumor is, it doesn't do any good.
What do you mean exercise? These people probably can't get out of bed.
And
what
you
do
know
mean
what?
Exercise?
Imagine my foot's there right behind them because they got to get out of bed or they're dead. Okay? This may be the toughest category. You got to get up out of your bed and get moving. If you don't, you're dead. You've got to move that body. Well, the first thing is just, I'm not saying we all need to start out running, a 3-minute mile.
Well, they can't do it.
That's right. Okay, walking. Start anywhere. Get up and start moving. More today than you did yesterday and more the next day. You got to move that body.
I mean, that is possible what you're saying?
Absolutely.
Even for people with lung tumors, brain tumors, they can walk?
Absolutely. And I force them. And
don't any of your colleagues say you're just being cruel?
Oh, they think I'm being cruel?
They're going to fall over dead trying to walk?
I worked with many doctors and watched them work with people with arthritis, advanced arthritis. Some doctors took a year to help people. Some doctors took 6 months. I saw Pavel Arola get people that were crippled for 30 years with rheumatoid arthritis out of their wheelchair and marching in 3 weeks. And he did it with a lot of yelling, and he put his foot up their rear end. That's the bottom line.
In other words, they had to get out and exercise.
That's right. If you rest, you rust. You got to move it. You got to use it. That increases our circulation.
All right, so you make them do some kind of walking, I assume.
Yeah, walking is a good start. Walking and breathing. Just even if you're walking around your living room, and if you're in a walker, use that walker. But you got to get moving more. Lying in bed is not going to increase your circulation. It's not going to heal you.
Anything else on circulation?
Definitely. I'm a great fan of hot and cold therapy. Later we'll talk about Dr. Christopher's cold sheet treatment, but I use hot and cold showers. If you go through history, you'll find that some of the greatest health centers in the world used hot and cold therapy. And even today, when you go to England and you go to a hydrotherapy clinic, they held me up against a wall last year and put a cold hose up and down my spine. You can go to Montage-les-Bains in France on the border of Luxembourg. You can go to Baden-Baden in Germany.
But isn't that just for people who are tired and want to relax?
No,
we're talking sick people.
That's right.
Here.
You know what it does? It moves blood. It's unbelievable. Let me tell you a quick story. I live at the beach in California, and I was driving down the beach. I saw the commotion. I saw the lifeguards. There was a girl on the ground, and she was in horrible pain. She was screaming. They had already called the county helicopter in to evac her out because the traffic's so bad at the beach, an ambulance can't go anywhere. I walked up. I talked to her for a second. I ran over to the grocery store. I got an ice pack, and I also got a burrito. I put it in the microwave and heated up a burrito. I came back and put that burrito on her pubic bone. I put the ice pack on her head, and by the time the county helicopter got there, she was okay. It's hydrotherapy, or hot and cold. Hot and cold is the fastest and most efficient way, and what I did, we forgot about the hot water bottle for painful periods. I mean, that's a shame. That's one of the most effective treatments. When you apply hot to the skin, you see the blood come right to the surface.
Of course.
And when you apply cold, the skin goes white and the blood's driven deep. If you want to stimulate blood flow to an area, you apply hot and cold and alternate it, and it's dramatic. Better than anything else I know. Better than herbs, better than body work. It's dramatic.
How do they do it?
Okay.
You climb in a shower?
We'll
is it
use
hot?
breast
Is it cold?
cancer as an example, or any area of your body that is hurting, an arthritic joint, whatever it is. The best thing is if you have a wand in your shower.
All right, let's say it's breast cancer.
Yeah, you take that wand, and when you make a shower, you're turning on both hot and cold water.
Right.
So now that you've mixed your shower, now reach over, and you're only going to have your hand on the hot, and you turn that hot up a little more to where it's as hot as you can stand it.
All right.
Once it's as hot as you can stand it, then turn that hot off all the way, and now you just got full straight cold on that area.
How much do you alternate? How many
15 seconds, let it go cold, turn it back up and do hot 15 seconds, cold 15 seconds, and do 7 hots and 7 colds, so 14 individual changes. And you do that on the area twice a day. If you're a really good patient, 3 times a day. And that'll drive more blood to that area than anything else you can do. And now if you have the power of the herbs in your body, and you have the power of the juices in your body, and the vitamins and the minerals and the enzymes from those juices and the chemical properties of those herbs, now you're going to get that blood to that area.
And you've seen that simple, it seems like too simple to do much good.
Yeah.
And you've seen it make a difference.
Oh, incredible difference. It's the most powerful tool that I know of that I put in the Incurables program.
Richard, how does a person do whole body showers, hot and cold?
Well, you know, that's one of the best ways, but it's a bit dramatic, and so I just want to warn everybody, you got to be brave and hang in there. But the best way to do this shower is just what I said, but do it for the whole body. Not only the part of your body that you have the disease or the tumor or whatever, but for the entire body. Just stand there, get that nice hot shower going, crank it up even hotter to where it's very hot, and then turn it all the way off.
What is it like? Doesn't that really get people? I've never done anything.
Well, the first thing that you notice is you have almost an involuntary breathing that takes place. You're just like, okay, but hey, there's nothing wrong with breathing. More oxygen. We're always trying to figure out how to get more oxygen into the body. It contracts the diaphragm. Now, if you're a very, very sick person and maybe have asthma or something, easy on that. You know, take it to cool first. But for the average person, if you want, you know, to stimulate that blood flow, hot and cold, and do it over the whole body, and then you might do an additional treatment of the hot and cold on the localized area where you have the problem. But it's one of the greatest ways to stimulate the circulation. There's a few other ways that I'd like to mention that a lot of people don't do, and it's unfortunate, is touch. We need to touch each other more, get some body work, squeeze those muscles and those tendons and move the circulation and the lymph flow through that body. We're not only exercising and stretching and moving to move that blood and circulation, we're doing the hot and cold showers, but get someone to grab a hold of you.
Now, this is something I would guess not normally done with terminally ill
You know, most
patients.
people don't, most terminally ill patients, nobody wants to touch them. They don't even want to touch themselves. I get patients that come in my office with breast cancer tumors that are the size of a large donut, and they've erupted out of the breast. There's a hole in the middle this big around,